Welcome to the tutorial number 1, Pre-Treatment Evaluation. We have assembled this series of videos where you're going to learn how to properly review the visual setup. My name is Dr. David Arias, Clinical Manager for de.exceed, owner of a private dental clinic, and previously a top performer clinical advisor at Align Technologies. When we first open the case, the first step that we are going to follow is to check the initial occlusion. So we need to make sure that this is accurate according to our patient. So we check that initial bite. If we want that case to be mounted in central relationship, that is something else that we are going to verify. Also the occlusal plane, and to make sure the overjet overbite and AP relation is exact. One good tip that we can use is to take the occlusal photos of the patient with articulating paper marks. So later we just go to the occlusogram, we go to the stage number 0, and we make sure that those contacts are just the same. So for example, here is in the picture, we have anterior contacts. But when we go and we see the 3D model, we are not seeing any anterior contact, so we know that there is something wrong with that bite. It is important that if you would like to start that case from centric relationship, you need to capture this position entirely in the scan or bite registration, and also we need to send the photos of that patient in maximum intercuspation and in centric relationship. After that, we verify in the chart of the patient if he or she is canted, and then we make sure that in the virtual setup the occlusal plane is identical. One tip is to take a photo of the patient biting a tongue depressor to see if that plane is canted. So for example, here in the picture, we can see that upper right side is a little bit more up than the left side. So if I want to fix that occlusal plane, I need to extrude more the right side and extrude more the left side. But when I go in the virtual setup, I see a straight occlusal plane that is not going to address that condition. That is why this occlusal plane is so important. Remember that to evaluate that occlusal plane, we need to click front. When we click front, we are going to see the occlusal plane which the technician is working with. An additional step that we are going to use is only when we see big gingival recessions in our patients. So it is important that when you see this gingiva in this position, that is going to be printed in the model where the aligners are going to be fabricated on. So if we move this gingiva more up, the aligner will be larger. If we move the gingiva down, the aligner will be shorter. So this is something that we can modify also if maybe we don't want the aligner to go all the way up, but it's something that we need to request to the technician when we are sending the files of the scan. Another useful tool that I'm going to have available is the grid. This is going to divide this setup in millimeters, so I can actually measure the amount of overbite, overjet, or maybe canine or molar relationship that I have at the beginning. So I can ask the technician exactly the amount of movement that I want to perform. So for example, in this case, we can see a big overbite. Those lower incisors, we need to intrude them. So I can tell the technician, for example, with this grid, that maybe I want to go and finish with a 2 millimeters of overbite. And I want to achieve those 2 millimeters of overbite at the end with 2 millimeters of lower intrusion and maybe 1 millimeter of upper intrusion. Maybe also to level up the gingival margins. So that is why the grid is also very useful. If we go back, we can remember that when we were checking the initial occlusion, we were using the occlusogram, but this tool also have a very useful point. we can use the occlusogram to show me if there is any interference at the beginning of that case. So for example, I can see that in this patient, this initial occlusion, both sides are biting almost the same. So when I see a yellow or a green contact, that means that I have a really good contact. But if I see those contacts more in blue, just in here like in the center, that means that I have a light contact, or that that surface is not occluding with the upper or lower tooth. And if I see red or brown colors, that means that I'm having a heavy occlusal contact. So I can actually tell the technician, remove all those heavy occlusal contacts, and in the end just leave me green or yellow dots. So remember that the first thing and the most important thing that we are going to do when we first open a case is to always verify that that initial occlusion is just the same as in the patient. We can use the photos for that. So thank you for joining us.